Welcome back, Smile Mentor family. Today is a little bit of an outside the box type of interview, and one I really enjoyed in getting to know Dr. Margolis out of the Phoenix area. He's actually out in Mesa. He is a very unique dentist in that he's also a biological dentist and understands integrative medicine. And there's a lot that goes into that. There's a lot more, and I've become a pretty big fan of this world of how your teeth are connected to every organ in your body, and how he's been able to help people through their teeth with other physical things that will blow you away. Seriously, you're gonna hear some stuff that might make you blush, but it really is cool to see how the body and the teeth are so symmetrically integrated, and what does that mean for implants and the all-on-4. So I hope you guys enjoyed Dr. Margolis. He and I have become also very good friends, and I can tell you, you're gonna learn a lot and also laugh a lot. Appreciate you guys joining us. If you haven't subscribed, please do. More information, read below. Appreciate you guys and have a blessed day. Dr. Margolis, I really want to say thank you for taking valuable time. We're here past hours. The sun's already gone down, and the fact you would take time to not only help educate me, but educate patients out there. And in what I've gotten to know about you, I'm really grateful that you'd hop on and join us for this. So thank you.
Well, I want to thank you. 2 nights ago, you gave me a phone call, and it was from out of state, and I had done some surgery on some out of state patients, and I don't know all their numbers, so I have to answer. This is Matt, and that's all I heard because you kept on cutting out.
Oh, man.
And you told me about what you were doing, and I said, I got to meet this guy. And that's how it's began.
Yeah, and I appreciate you just stepping out and doing that. And we've talked about why the heart behind this of doing the full mouth restoration on implants, and initially you told me that you don't do the 4-on-4, and I understand that. And that's what's crazy is most patients out there think that the full arch restoration is synonymous with the all-on-4 or the 4-on-4. Whereas clinicians think about it a lot more along the lines of how many implants and what is the actual procedure you're doing to place them, correct?
I would say that's your average person.
Yeah.
And the person that's going to be pushing the 4-on-4 is going to be an oral surgeon and a prosthodontist that usually work together. And you have many different businesses under different names that do that. It is a fine restoration for some people,
Yeah.
especially if you lack the bone to be able to put many different implants in.
Right.
But they're titanium based.
Yeah.
I'm a biological holistic dentist. I do not believe putting metals in somebody's mouth is healthy for that individual.
Well, that's going to tee us up, and that is the reason why I researched you. The way I came to know you is I know Dr. Dino Prado well. I've got the utmost respect for that guy. He is doing things that others just say can't be done.
They don't even dream about it.
They can't even comprehend
Dr. Prado
it.
is amazing. He's always been ahead of the curve,
Yeah.
and he has always stepped out and taken the challenge, and has put his actions where his money is, or money where his actions are.
Yeah.
And his goal is to make a better life for individuals.
Yeah.
And you know the patients he gets.
I mean,
They've
been almost forgotten about by Western medicine. They go get your affairs in order. We've done everything we can. Good luck. Go home to die. That's who he gets a lot of.
I know. I've seen many of his patients. He's referred me now.
When I was talking to Dr. Prado about, you brought up the fact of the biological dentistry, and with my experience, not only with dentists, but I've also had a lot of experience with integrative doctors, and I've learned, what made me so powerful on the dental side, my love for dentists, and my background, my background with that has also helped me on the integrative side, because there's a lot in integrative medicine that has you go, what, really? And as a layman, if you will, or a not stupid, but uneducated patient that, where I was going, where I first started hearing about how your mouth is connected to your entire body and how it affects your entire body. It really took me a hot minute to really even comprehend that. I do believe that now, but do me a favor. Help me understand that as though I am for the first time coming and hearing what a biological dentist is and why that is so important and how the mouth works together. It's a lot, I know.
Whoa.
Yeah.
A biological dentist believes that the mouth is connected to the rest of the body. In medicine today, we have specialists in hands, we have specialists in feet,
Right.
we have specialists in eyes, ENTs, we have specialists for every specialist, there's a specialist. And they seem to lose the forest within the trees.
Yeah.
And unless you could connect and take a look at what one part of the body interacts with the other part of the body, you say, oh my gosh, how can this be? So when you started saying, well, the mouth is integrated to the rest, I have the pleasure and honor of having one of my sons who is an oral surgeon today. And when he went to dental school in another state, I always flew up to see him every year. And he would tell his classmates that, gee, Dr. Margolis, my dad, will look at a panoramic x-ray, which is the one that goes all the way around your mouth. And he will tell you your health history. And they sat there and said, that's impossible. So I come in there, I just come to visit my son, and I go up to the clinic, which is this big open clinic with people drilling on mercury fillings with no protection. They are putting mercury fillings in with no protection for anybody because the mercury vapor, as you know, is a neurotoxin. And when you look at that, you go, how the heck can you do this? But the American Dental Association says that you have to put it in a very special way because when it's transported across state lines, it's in a special container because it's toxic. When you mix it in the room, you got to have an open room with a lot of ventilation. You're not supposed to breathe it. And then they aren't supposed to touch it. They put it in something called, after it's mixed, an amalgam well. You take it and you put it, without touching it, into the patient's mouth, into the tooth. You pack it, you take the extra, you suck it up with that suction tip. And then they carve it off. And that's when they condense it, is the most mercury release that you're going to get unless you're a hygienist. A hygienist polishes these things to make them nice and pretty, and they're releasing more mercury vapor in the air, and they're breathing this, and many of them have had miscarriages, by the way.
Really?
Way higher than the average American. And then once you're done, you take the extra, you put it in a glass container with a liquid, a fixer, and you dispose of it as hazardous waste. So according to the American Dental Association, the only safe place to store amalgam or mercury or silver fillings is in a human mouth.
How in the world? Okay, so why is there such a disconnect? I mean, I hear you tell this, and I'm just sitting there, and I'm thinking about my parents and all that my mom went through. I'm thinking about my dad. I'm thinking about me, how I had, after I met the Scaniers, I went and got all my amalgams out. And so, because, I heard about that, and it made sense. So where's the disconnect? How does this happen?
Well, if you take a look at who owns the patent, or was the last owner on the patent for mercury, American Dental Association.
Really?
Yeah, they were part of it. It was a financial thing. Did you know you used to endorse many, many products? And they say, stamped with the seal of the American Dental Association. Well, people started asking questions. A gentleman who was one of my personal heroes, Hal Huggins, lost his license for saying that mercury was dangerous. But he developed MS as a result of taking out mercury fillings. And mercury sounds like many different other diseases that will occur. And so when we take out metals, mercury especially, out of people's mouths, it has to be done in a very specific way. You have to have a room that has ventilators, that have suction tips, that the patient and the staff has. We have respirators that we use,
I
and
saw
the
those.
patient has a separate supply of oxygen. And we use a rubber dam so chunks don't go down person's mouth. We put the slow suction underneath because the rubber dam doesn't stop gases from going through. And then when we're done, we rinse their mouth. You can use chlora. We give our patients charcoal pills and liposomal vitamin C, which helps clean up the body. But then we refer them out to naturopaths and homeopathic physicians, MDHs, and we help each other. This is not a one-man show. I can't do without the support of a good group of people that I work with, over 50 different physicians in the Valley that refer me patients. And unfortunately, I can't refer everybody patients, but usually they're referred into me because they're sick. But that goes to the fact that everything that goes into your mouth goes through your body. And when you look at a person, let's say they have a heart attack, nitroglycerin underneath the tongue, bingo. Why? Because it's the most absorbable part of your body.
I've heard that where you drop things underneath your tongue and it will hit you the fastest.
Yes, and it gets the fastest. That's why when you're taking mercury out, you want to use copious amounts of water and you want to suck it out. And we use the extra saliva tip in there underneath to collect anything extra because we don't want those vapors in your mouth. That's what's dangerous. And if you drink coffee and it goes over 110 degrees, which usually, it's easily, or it could be boiling hot, it's going to release a vapor every single time. Same thing when you chew. You chewing gum and you got a mouthful of mercury, you got a mouthful of vapor. So, but that's just one metal. When we look at the fact that I would not do any implants until a zirconium oxide implant, which is a ceramic, was available in the United States for commercial use by dentists.
Okay, so now we're really going to get to, I have talked to a lot of people about this because I really was debating when I went through this procedure whether I should get zirconia implants, and my doctor did not use zirconia. I had a challenge finding somebody there that would use zirconia, and so I went with titanium. What am I at risk for? Let's start with that. I know I'm the subject. We're not talking about anybody else. This is Matt Griffin, and I'm okay. Tell me the bad news, Doc. You know what I mean?
Well, hopefully it's not totally bad news.
Okay.
You're a 4-on-4 case. There are no zirconium implants for 4-on-4. It just doesn't exist today. Now, you could use the attachments on top of the zirconium implants or titanium implants. You can use the zirconium attachment. And many of the restorations that are made for the full arch are zirconium.
Yep.
You know that.
Yeah.
And they will use a stainless steel screw. The problem with metals is there's never always one metal in there. Titanium, I had a guy come in here, he says, I got the purest titanium implant in the world. I said, that's very noble of you. And so it was, the guy was from Noble.
I got it.
Okay. So we started talking. I said, okay, what's in it? He says, titanium. I said, what else? He goes, well, it's titanium. I said, no, it's 2% nickel. He was like stunned like you. 2% nickel. Why? Because you need it to be able to cast it that way. You're also going to have a little zinc in there because zinc cleans up the mess in the metals. It takes the impurities out. And it's a good thing. But then when you start doing the attachments that go on top of a titanium implant, a post that's usually metal with a different type of screw, now you've got 6 or 7 metals. Now, there is not one cast crown that uses a pure metal. It's always a combination. It will be 35% X, Y, or Z, and then others. And so the problem is you got mismatched metals, dissimilar metals in a hydrophilic solution, your saliva. has enzymes. Enzymes mix with the metals and create extra electrons. So what do you do when you eat? Let's think of your favorite meal.
Okay.
All of a sudden your mouth starts to water, doesn't it? You get that saliva going.
Right.
It surrounds all those metals. And then there's a galvanic charge that goes between them.
Okay.
Have you ever opened up, now today with the cars that they have, you can't even find a battery. But in the old days when we were growing up,
Right.
did you ever see that crusty stuff on a battery?
Oh, yeah.
Yeah. When I look at a patient and I see that they got multiple crowns of different colors, I tell my hygienist, look for the cavity between the two teeth. And they came to me when I first told them this. How did you know? I went in there with an Explorer and I could feel the softness of the enamel underneath the crown margin where the metal meets the tooth. It was always soft. And that's where the cavity starts. So you could get the best, finest dental work in the world. And I've seen some great stuff come through here by other dentists. And I say, God, I wish I could do as good as they do. You know, please. But what happens is over a period of time, they get that galvanic charge. Now that galvanic charge is that dirty battery buildup that you see in the car is happening in your mouth. Now you wash it off with saliva, but it works its way. And that's why so many people get re-decay. You know, you're not supposed to put a mercury-based filling next to a gold crown. Do you know anything about mining? How do you get gold out of a mountain? You inject it with mercury. And it pushes, they attract each other. Pushes out the gold.
Really?
Yeah. Look it up. You'll find out it's really interesting. So what happens after that? Now you got amylase, which is the enzyme that starts the digestion in your mouth. Now everybody knows that you have to chew your food till it becomes a paste. So you have to chew 35 times or so, sometimes less, a little more, you know, and get it so it's really pasty. Okay. So you don't get these big chunks going down your esophagus into your stomach, because the acid in your stomach is supposed to be 1. If you took acid from a person's stomach and put it on a piece of metal, it should dissolve the metal.
Yes, I've heard that.
Okay? As we get older, your hydrochloric acid gets depleted. I take hydrochloric acid with my meals because I'm an old fart. I'm 68. And I turn around and I put that in there, and I could figure out for each meal how much I should take. Because if you get an acid reflux, I took too much. But generally I just take 1, and it lowers the acid and I get a better digestion. But you should chew your food till it's a paste. Now what happens with the amylase, it's picking up electrons. It's becoming less effective as an enzyme to dissolve that food. And then what happens when you swallow and it gets into your gut, you get something called leaky gut syndrome. Have you ever heard of a leaky gut syndrome? That's because the chunks are so large that you can't get the 6 carbon to 9 carbon breakdown of your food so you could swallow and digest it properly. So you're messing up your gut. So your first question when we started was, how does the mouth affect your body?
Right.
Well, if you try to talk and you have no teeth, you can't pronunciate your words.
I get it. When I had them all out and I tried to have a conversation.
Doesn't work very well, does it, boss?
It doesn't.
No.
It doesn't.
But through the miracle of dentistry today,
yeah,
you go ahead and you got 4-on-4s, both arches. You have very nice looking dental work. I haven't seen the x-rays, but I would say that was a superior job. Yeah. If you came to me, I don't do 4-on-4s. I do individuals. And I try to get an approach that, like Dr. Carl Misch would teach in his classes. The Misch Institute is a great place. If there are any dentists listening to this, that's where I really learned dentistry and implantology together and how it works together. Randy Resnick is the top dentist lecturer, and the man is a walking encyclopedia. And he's a great guy. And what he does, they teach 5 implants across the front here. And then you go back to about a molar and you use 1 solid piece. And you do the same on the upper. So they try to use more implants lined up so you can place the whole arch. For myself, I use a different product. Am I allowed to say the name?
Sure.
Swiss Dental Solutions, Dr. Volz out of Switzerland. And their whole company has been fantastic. In fact, I met Dr. Volz when he started Z Systems. And he made a 1-piece zirconium oxide implant that was fantastic. It was limited to what it could do because it was 1 straight solid piece. They went into a 2-piece system that was gluable, which actually turned out to be a total disaster because the glues didn't last. But when he apparently something in business, he sold his interest in it because they were trying to take it over, and he said fine. Then he developed this over the years, and this is the finest implant I've ever seen. It's made dynamically so the bottom part of the implant looks like a wood screw. So when you take out a tooth, after cleaning out the periodontal ligament, which we can talk about if you want more later, and clean out the socket, then what you do is you can place that implant along with PRF. Now PRF is protein-rich fibrogen. Everybody has it. The place to get it is in the patient's blood. We draw the blood, we spin it, and we separate it. And then we use the PRF in the sites, and it actually will grow bone. It's the most amazing thing I've ever seen. And if you don't need more bone, it will grow your tissues.
Wow.
God works in many great ways.
He really
and
does.
So I just sit there and I just go through everything and look at it, and I scratch my head. That's how I went bald. I said, how did that happen? And I go, wow, that's amazing. No, it wasn't my kids. I just didn't know all the answers, and I'm still searching for them.
I love it.
But the whole thing is, we will do multiple implants if we can. Now, if I have a patient come in here and they don't have much of a jaw, I have some excellent practitioners that I send them to here in Mesa, Arizona, right down the street. And they are fantastic. They do a 4-on-4, and they have a lab that they work with, and we go ahead and do their product, etc. But the whole point is each person has an individual genome. You look at it and you'll see how you do or how you don't do. You ask me, what am I looking for? You may not have any problem. People who have Alzheimer's disease, Parkinson's, probably could be an MTHFR, which is a genetic defect that you cannot process mercury and heavy metals. Others on chromosome number 19. You have a arginine setup, for one from the mom, one from the dad, or you have a cysteine setup, which loves mercury. It will grab the mercury. It will take it, you'll pee it out, or you poop it out. And then you have a combination of both with a little less efficiency than if you have that. So it's actually a genetic thing. I know people that I think they could drink mercury and won't affect them. Other people,
Really?
Other people, so it's a genetic problem. This is all research done by Boyd Haley, who was the past chairman of chemistry at the University of Kentucky. And he actually developed a product that was called CRS. It's a new name today, that the FDA closed down. He made no claims. He sold it as a food supplement. And what it did was it helped autistic kids get better because it sucked the mercury out of the body. He has had clinical trials in South America at mercury mines on people who are exposed to mercury all the time.
Yeah.
And he's done some phenomenal work. And it's been shut down because people were making claims, not him. But these were parents who were trying to help other parents help their autistic children.
Let's take a step back for a minute. Biological dentistry, believes that the whole body is one, including the mouth. And I've seen some charts that show how each tooth can even be connected to specific organs. Yes?
Yes, we have that chart in the office.
And I saw, and you know, you were talking earlier, you know, as you gave me the tour and as we were setting up and really getting, I saw the different suction vacuums, and it's a different kind of practice than I've normally been exposed to.
Well, we're actually a COVID ready practice. If you follow biological rules,
yeah,
anytime
That's a good
we
point.
create a mist in the mouth, we have a product that has like a trunk, and it's in front of the patient's mouth, and it's a vacuum cleaner. And what happens is, if the hygienist is polishing teeth, she has that in front of the patient. So any spray goes right into that. If we're cutting on a tooth, if we're adjusting an appliance, it's right there.
Yeah.
So when you come in here, the air fresheners that we have, the filters that we turn on at
The
night,
water that your filtration, you got a whole room that's just filtration.
filtration, and under the sinks.
Yeah.
So our water is filtered 3 times before it even hits the patient's mouth.
So, okay, I'm going to play devil's advocate, okay?
Okay.
I'm going to go where I started off when I first heard this. Isn't that a little overkill? Why? Why do you need to do that? Why do you need to filter it 3 times? What does this do? Tell me. I mean, I'll teach me as an ignorant person.
Well, how many times have you heard Flint, Michigan, and the problems that was in the water there?
Yeah.
But what about the water's stuff that you don't see, you don't taste? Fluoride. You don't taste fluoride. Fluoride is a neurotoxin. Hitler used to put it in the water in Berlin as they were losing the war to keep people docile so they wouldn't revolt against him.
Okay, that has to be somewhere I can prove that, yes?
Yeah, you just have to read history.
Okay, so guys, for this, I'm going to include some links because I know this is an outside the box series, which I actually get really excited about because what I've gone through with my family, not on the dental side, on the health side, I've learned that Western medicine doesn't always have the answers, and a lot of times it doesn't. That's what drew me into a lot of the alternative side of things. So what I'm going to do is I'm going to treat the viewer, you, as though I was when I first started down this journey. Very skeptical, as you guys know. I'm a little jaded in some areas. So I'm going to do some research, and I'm going to include all these links down in the description. But I really want you guys to understand there is a lot more we don't know than we do, especially as patients. So that cueing in fluoride, why? Why is it like the ultimate end all for all of the toothpastes, and they talk about putting it in water and how that helps? Why? If it's bad, why do they put it in?
You want me to start from the beginning at the Manhattan Project?
Let's start. Yeah, tell me. Educate me.
Manhattan Project was the development of the nuclear bomb back with FDR for World War II to try to end the war quickly. And the fact is that 2 bombs were dropped on Japan, really a lot of casualties, obviously, but saved millions of American lives. They didn't have to go in and try to invade a nation, a very proud nation. And so what happened was you needed fluoride to develop the plutonium and process it so it would become a nuclear weapon. And the area it was developed in was DuPont, New Jersey. And they were seeing animals with 5 legs, and different crops were all dying. The nails in the workers' shoes were dissolving. And nobody was to know about this. You know, they figured how putting rubber boots on over your shoes would help. But a lot of people got sick, and nobody really knew. And the problem is fluoride is an end product. It's one of the basic elements, and it's highly toxic. In fact, it was used in mouse poisoning, rat poisoning, because it killed the product. But to the human being, it's a very slow slow process. And if you look at fluoridosis of the teeth, those teeth break down really bad. It's destructive. It discolors your teeth and just isn't something that you really want. Also collects in your pineal gland. The pineal gland in the center of your head next to your pituitary. That is your rhythm gland. That gives you women their period, gives men, I think, have something similar to it, even though it's not as obvious, and your ability to sleep. And it solidifies. We don't have a way to get rid of it in our body. Broken hips. CDC has study after study showing that if you have a higher concentration of fluoride, you have generally a higher correlation of broken hips.
Osteoporosis.
That's part of it. That is part of it. It stops enzymes in your body from working, and it's a neurological poison.
So how did we get from the Manhattan Project?
Okay, from the Manhattan Project, they had all this extra fluoride left over. How do you get rid of it? Well, if you go out west, there's natural fluorine in the water. Not fluoride, but fluorine. The product that they put in the water, hydroxylic acid, fluoric acid, is a poison. But if you put it in low enough dosages, they said, oh, well, fluorine, that's the same as fluorine. It's going to stop cavities, because these people didn't get cavities. They got discoloration, but they didn't get cavities. And if you look at David Kennedy's work, he's a dentist who has been all over the world campaigning against the use of fluoride. He had the pleasure of going to China, and there was one province in China that was full of fluoride. And they had the people that were so bent over at age 25 they couldn't stand up straight. And he showed them how to filter their water from the fluoride. He has whole documentation on that. And so the fluoride had to get rid of. Now, if you dispose of it, which is very difficult to do, where are you going to dispose it? What are you going to do with the stuff? But if it's a health promoter and we're going to stop cavities, we fluoridated the city of Chicago, the home of the ADA, for 70 plus years. And you know what? Kids still have cavities in Chicago. Doesn't seem very, very effective now, does it? Off camera, we had a discussion about masks, wearing masks because of the COVID.
Right.
And the last round, 85% of the people wearing masks said, or who had COVID, said they were wearing the mask all the time. Yet 85% got sick. So we have a habit in this country.
Yeah.
Follow the dollar, number one. If you look at your water boards, there's always somebody representing the fluoride industry on that board, influencing it, putting the people in the right position to keep it going. And the truth shall never be known.
Okay, how did the ADA get on board with it? You know, you got all this in toothpastes and, you know, I mean, I was at a health food store back when I lived in Arizona. I went in for, it was for like a St. John's wort supplement, but I was talking to the lady behind the counter and I saw this toothpaste and I picked it up and I was like, $10 for toothpaste? You gotta be kidding me. She goes, well, it's got all these, you know, it's got tea tree oil and blah, blah, blah. She goes, and it's fluoride free. I said, well, doesn't that mean that I will get more cavities? And she goes, no, wait a second, you don't understand. She goes, when's the last time you looked at the back of a toothpaste bottle? And I said, okay. She goes, it has a warning on there. You understand that, right? And I said, what do you mean a warning on there? She goes, go look at it. And that's what I did. I went home and I looked at it and it basically said it's harmful to ingest it. And yet this is toothpaste you're putting in your mouth.
And our kids get toothpaste that tastes like bubble gum. Now, are they going to spit that out or are they going to swallow that?
Right.
And there have been kids that have died, product liability. There have been cases that have settled for hundreds of thousands of dollars. I'm sorry, you can't give me enough money to pay for the life of my child.
Right, right.
It doesn't work that way.
Right.
And fluoride is, they at least passed that. But what was on that box? The seal of approval by the American Dental Association. Who supports the American Dental Association? Well, if the American Dental Association supports your product, It sells. People will say, is this ADA approved? It's almost like saying, is it FDA approved?
Almost.
And unfortunately, I can't tell you the acronym that I use for FDA. There may be a family listening. But it's sad. It's sad.
Yeah.
When you go through and you look at the body systems, let's take a look at your joints. You need to have good nutrition. You need to have calcium and magnesium and all these other things. But I used to just eat Knox gelatin because I had a bad knee that was injured in sports. I got a torn rotator cuff. I ate Knox gelatin because it helps build up the body nutritionally. And if you go on the market and you look at nutrition and you look at the pills and you look at the supplements, it's a multi-trillion-dollar industry.
It's a big, yeah.
It's huge.
Yeah.
It's huge. So you can't tell me that the body's not connected to the mouth, because if you can't swallow, how are you going to get it in you?
Okay, but the teeth. Let's start. I want to start there. I have one of the things that was taught to me when I was working with Dr. Cowden and some of them was how each tooth, you can even sometimes tell a person if they have an issue, or the equiscope, like what I did for help healing my my abscess. They even talked about how you can treat the teeth to treat the body. And I thought, okay, this is crazy, right? But how, I mean...
Okay, as a biological dentist, we use a technique called trigger point injections.
Okay.
Janet Travell and David Simon, who are both MDs. In fact, Janet Travell was John F. Kennedy's pain management doctor.
Okay.
And she did trigger points. And trigger point injections are to release the muscles that are in spasm.
Okay.
So let's say you have a shoulder. Your right shoulder doesn't feel good.
Okay.
All right. I take an x-ray. I look at the structure of the teeth. And generally speaking, I will see a root canal or an abscess tooth or a problem in the upper right back molars or the lower right premolars. And I will take a syringe and I'll use a anesthetic with no epinephrine. Epinephrine's a vasoconstrictor. And we can talk about that because that's not healthy for you either. And I will go in and put 2 or 3 drops using a particular method of dragging the needle in the buccal mucal fold. So when it comes up and goes down to your gum, I slide that needle and I sit back and I look for a bleeding point. And when I see that bleeding point, I put the needle in 1 to 2 millimeters and use 1 or 2 drops. And then I go 2 millimeters forward, 2 millimeters forward, and I go back to the original and go 2 millimeters back and 2 millimeters back. I've had patients come in, they can't move their arm any further than this. And then I do that and they got their arm all the way up here. And they said, what did you do? I said, I opened your meridian. That root canal that you have there is poison. It's toxic.
Okay, let's bring that up. I believe that. I saw the movie Root Cause. That was well done, I thought. Got pulled. I saw that. Of
course. I know 90% of the people in there.
Do you really?
Dr. Tom Levy. Thomas Levy is a cardiologist. And he worked with Hal Huggins, who I had mentioned earlier.
Yeah.
And Tom has got to be one of the most intelligent people I have ever had the pleasure of meeting. His new book, if I can put a plug in,
Please.
Everybody should read, is called Hidden Epidemic. And it talks about how sick everybody is as a result of their root canals and something called cavitations. Cavitations in a medical dental sense is called a chronic, long-term, ischemic lack of oxygen, osteonecrosis, dying or dead bone. And it's due to the lack of oxygen getting into the bone because the surgeon who took out the tooth didn't clean the bone out properly, leaving behind something called the periodontal ligament, PDL. Now, you know and I know that ligaments hold bone to bone. So teeth are actually specialized bone. And teeth make up an organ. It's not just a tissue. Our liver is an organ. Why? There's a lot of lobes that work together to filter your digestive foods and get rid of the waste and bring the good out,
Okay.
whatever. So teeth work as a whole system. And they are an organ, but people don't look at it as an organ. And it has a blood supply, a nerve supply, lymphatic supply. It serves a purpose.
Lymphatic supply?
Yeah, your lymph nodes go into your teeth and help drain it. Your whole jaw has lymphatics. When we feel down your sternocleidomastoid muscle here, you come down here. When I'm checking for oral cancer, I use something called a oral ID special light, fluorescent light, special glasses. We look in the mouth to see if there's a change in the consistency and color of your tissues.
And that's what you let us, on your patient who was so gracious to let us look in. Dan and I got to look into that with those glasses, and you shined that special light in, and that's what you were looking for.
We were looking for cancer. Thank God she didn't have it, but the first year I used that, I had 5 patients that had oral cancer. Now, I personally don't want to treat oral cancer. So I called my oral surgeon, Dr. Fish, and Dr. Sangruin. That's people I referred to earlier. And they're traditional dentists. And they are like the only oral surgeons that back me up because I do different things. I take out root canals. Does the patient have a right to have a root canal removed if they feel it's harming them? Or they just want it out as a medical precaution?
Yeah.
And, you get in trouble with people on that in the other side because they say, you extracted perfectly healthy root canal teeth. Well, Dr. Boyd Haley used to do a toxicity test for different teeth. So we did a study of 5,000 root canals from all over the world. We sent them in. And he ran it through electrosynthesis bath that he had developed. And he would put an enzyme that's in the Krebs cycle, which creates energy in your body. And he would take that enzyme in a bed that was filled with your biopsy samples and then bring it all the way through and measure how much of that enzyme is left over. How toxic was this material that was in your body? And I submitted well over 550 of those samples. You know how many were toxic out of the 5,000? Take a guess.
Okay, well, if I'm being lobbed the question, I bet that it would be north of 4,000.
Yeah, it was 5,000.
5,000, not one that wasn't.
Every single root canal was toxic.
Okay. So what I've learned about this, it's a dead, they say, well, you wouldn't leave a dead kidney in if your kidney failed. You wouldn't leave, we don't have. So I've heard that, but I think of tooth. Okay, it's like a bone, like you said. So I've got a hollowed out bone that's just hanging out there. You removed the root so that there's no pain. That's what a root canal is, right?
Well, you remove the nerve, blood system, and the lymphatics in the canal of the root. You didn't remove the root because the root is what's part of the tooth.
Okay, so you're saying because the blood supply, the lymphatics, and the nerve are removed, that's where they do the scraping and get it all that out.
Well, they don't get it all out. That's the other problem. Okay. It's almost impossible. Your dentinal tubules are 30, 35 microns. You need an electron microscope to see it. And the canals may be bigger, but you have all auxiliary canals. You have tiny little things like a delta that you see in a river. And you can't get in all those. And so now they're using microscopes to try to clean them out. And they do a better job. And it does serve some of the public. But the problem that you have is over time, bacteria will get into it because you can't seal it. Let's say you cleaned out all the tissue.
Okay.
Bacteria is going to find a place where it can live. And when bacteria gets in there, the protein that you could not get in the dental tubules out decomposes. That's called food. and it leaks out because the tooth sits in a periodontal ligament. And so when I bite, my teeth go into the socket here and into the socket up there. And then when it releases, the teeth come down a little, and it gives me proprioception, which is really cool. But what's happening is I'm also getting rid of the waste within the tooth, and I'm causing, on a healthy tooth, pressure that is a pump. So the blood and the nerves and the nutrition and the oxygen and the CO2 coming out are pumped in the tooth by the periodontal ligament that causes everything to move and flow and gives life to that tooth. Now you've taken out the life system of the tooth, but you can't clean all the protein out in the dental tubules. It needs oxygen. It needs nutrition. It's not getting that. It decomposes. Where does it go? It goes out into the periodontal ligament. Now, you asked me connections of teeth. Your first 4 front teeth here and here are on your urogenital line. That means it goes down to your urinary tract, your sex organs, and your peer. I have had patients come in. The problem was one guy was impotent. He had been married 18 months, and nobody could figure anything out. He had been in a baseball accident. He knocked out a few teeth. He had root canals down here and another one over here. And it happened to be his wife that knocked him out, by the way, before they were married. And so she is devastated. They're 18 months in their marriage and he can't get an erection.
Oh my gosh.
So I sat there and I said, okay, let's use the acupuncture trigger point injections and we'll see if that does anything. So you know the Valley. He lived in Sun City West, came to see me, and I did acupuncture along here. And I said, here's my phone number, give me a call. And the next morning while I'm in the shower, the phone rings. I finished my shower. I go ahead, I take the thing, and there's a voicemail. And it was him. He says, Dr. Margolis, my wife has one thing to say to you. And so he handed her the phone, and she goes, whoopee, and hangs up the phone. They had their first child 10 months later.
No, they didn't.
But he didn't come to me to get the work done. He went to somebody else to have the teeth extracted. And he was wearing a partial, which was metal-based. And he became impotent again.
Oh, no.
And he called me up and told me I was mean and cruel and everything else. I said, what did I do wrong? He says, well, I can't afford you. And I said, well, I'm sorry. But what's the problem? And he says, well, we had a baby. I wanted you to know that. And I credit you for that. I said, I didn't touch her. Please. And second, after that, he just disappeared. I don't know whatever happened. It's heartbreaking because, you know, if people have a hardship, talk to me. But it's my fault. So anyway, that's just one. So your canine teeth are going to be your liver and your gallbladder,
okay,
as will be your upper premolars and lower molars are going to be your lungs and large intestine, and your back molars and premolars are going to be your stomach, your thyroid, parathyroid. And that's how I got into this. And I'll tell you that in 1 second. And your wisdom teeth is going to be your circulation, your heart, and your duodenum, jejunum, your small intestine. I had a root canal done many, many years ago. And I was involved in a car accident. So it's this tooth number 3. If you can see it, it's not there.
Yeah.
Everybody says, why don't you put an implant in? Why don't you get a bridge? Why don't you do this? I can't tell my story. Okay.
I lose my prop.
I don't have my prop, and all I got to do is go, all right, here it is. So within 5 days, the car accident, I was waiting to make a left-hand turn, and a tow truck hit me at 45 miles an hour. I had no idea I was going to get hit. I got a torn rotator cuff in here. That's as far as this arm will go, because I pulled the car from oncoming traffic. Anyway, one guy came back to see if we were all right, And he peed in his pants because he said, if you didn't pull that car the way you did, you would have been hit head on by mine. And so, long story short, my neck went from 17.5 inches to 24 inches. 5 days. I was misdiagnosed with thyroid cancer. My ex-wife insisted that I get the surgery. I said, let's wait 6 months. And the doctor told me, oh, you wait 6 months, you could be dead from thyroid cancer. Thyroid cancer is one of the slowest cancers in the body.
My wife had it, yeah.
Yeah, and it's not something that's going to kill you in 2 months.
Right.
And I said, let's check it in 2 months. Now, I had to do it. I finally went ahead and did it. And the biopsy showed it was totally perfect. It was totally normal. Then I became a diabetic. Then I started searching. I started searching for answers. How could this cause me to get sick? And then the capper was kidney stones. First time in my life, I had kidney stones. These teeth connect to your kidneys. So if you take a look at Dawn Ewing's book, Let the Tooth Be Known, she goes through the entire chart, tooth by tooth, so you could learn exactly what it is. Or you could go to my website, mydentistaz.com, and we have an interactive chart. We're rebuilding it, so sometimes it doesn't work, sometimes it does, but we'll get it there. And you can see what tooth is connected where.
I'll put the link in for you guys on this so that you guys can find it, but that'll be another one. Look in the description. But go ahead, please.
Yeah. So, yes, the body is connected. I cannot tell you the hundreds of patients that I've cleaned out past extraction sites called third molars, and how many were on blood pressure medicine. And once we clean that out, I never tell a patient, get off your blood pressure medicine. That's not my position.
Right.
But they would go in and get re-examined, and the doctor says, what did you do to your blood? How did this? You don't need that much medicine. In fact, I don't think you need any. And he said, what did you do? He says, I saw my dentist. Other cases, when it comes to root canals, I had a gentleman come in, his right hand, couldn't use it. He's right-handed. He distributes, he's a wholesaler for electrical parts. And he just was in pain all the time. If you went like this, he was on the floor. I went to shake his hand, wouldn't touch it. So he was sent to me by a colleague of mine, Dr. Bruce Shelton, who is no longer with us. And he said, go see Margolis. He says, what am I going to go see a dentist for? So I did my little acupuncture injection, and all of a sudden, his hand moved. He couldn't do the simplest thing. He was this far, and that was it. He came in, I took out that root canal, I took out a titanium implant that was horrible. His body couldn't take the metal. And the bone was crap, actually. And so I took that out and cleaned up all the metals in his mouth. And he came back 2 weeks later, and he shook my hand. He says, I don't know what it is, but you saved my life. I was at wit's end. I was about ready to end it. So we talked a little while, and then I did the other side. And he did really, he's doing great today.
You know, so this is such a different form of dentistry, and I'm, you know, as you're talking, Dr. Margolis, I'm sitting here thinking, my gosh, we don't have enough time to cover everything, so I am going to be back, just mark my words. We're going to do another one, but I'm sitting here and I'm thinking about, I don't know. There's a lot of clinicians out there that are going to be watching this. I just know they are.
I hope.
And, you know, I know the paradigm into which we find ourselves, and that is, you know, you're taught, we're sheep. We are sheep. I mean, humanity is sheep. That's
just look what happened with the COVID.
Yeah.
I mean, people just blindly closed down.
Blindly.
I got shut down by the government and couldn't go to work. And even if I went to work, people were so afraid.
Yeah.
And yes, it is a problem, but we know facts about it today now.
Yeah.
And, you know, what can you say? The best thing was that people stopped moving around the world spreading the disease.
Yeah.
So,
And so, but you got this, you've got training, you've got indoctrination. I guess that's probably a strong word, but whatever, I'm going to use it. But you've got this training that most dentists I talk to, just like you talked about your son, you would go up to these clinics, you would do it, you would show a panoramic X-ray, and you could help identify their health issues. And so most dentists are probably going to go, what? This guy's crazy, right?
well, most dentists, there was a periodontist, a guy who specializes in gums. And so one film was held up to me, and I said, you got a diabetic here. And the student says, he's not diabetic. I said, oh, yes, he is. Take a look at how the gums and the bone have receded evenly throughout his mouth. And he looked at me, he says, I'll prove it to you that he's not diabetic. I said, okay. How do you know that? He says, well, that's how he answered the questionnaire. Not diabetic. I said, do you believe everything that you read? The patient was sitting in a chair across the way. And he goes up to the patient and says, Mr. So-and-so, I got a question to ask for you. Are you diabetic? And the man turned white. How did you know? He says, I just got back the results from my specialist, and he told me I'm diabetic, and I never knew it. Now it explains why I got the problems in my mouth, why I'm getting all these cavities. The reason he got the cavities was he had all mercury in there. He's diabetic, uncontrolled blood sugar. The metals are playing havoc with his blood. So there are connections, direct connections.
So let's say first, if I'm a patient, where can I go to learn more about this? You've given me some books. I'll put the links in there. Where else, if I'm a patient and I say, you know what, I don't know if I buy all of this hooey, but I'm at least willing to research it, you know?
If you want to research it, I'm past president of the International Academy of Biological Dentistry and Medicine. I'll give you the link there.
Okay.
I am a member of the International Academy of Oral Medical Toxicology, IAOMT, and also the Holistic Dental Association. Those are three good beginning spots.
Okay.
I would go in that order because I'm prejudiced. I'm president of one, but I'm also a master's in one, I'm a fellowship in another, and all the other things. I have spent more time educating myself in doing implants today. Also got a degree as a Doctor of Integrative Medicine from Capital University that no longer exists. So I try to combine all these different things that I've learned and put it together. And it's an interesting concept. You can tell patients by whom they are, what they say, and how they believe. I find that most people who have faith, doesn't matter what faith, they could be Muslim, Christians or Jews, or something else. It's just spiritual. If they are, and they want to heal, they do heal. But those who don't have any faith in anything other than themselves, no supreme being, that is kind of amazing. It doesn't matter how you take the path to where you go, but the good Lord's there to help everybody. Yeah. All you got to do is ask.
Yeah. And that will get us into a whole nother conversation. But if now let's say you're a dentist watching this, and you're in the comfort of your own home. You're not going to fear any ridicule from your fellow classmates. You're wanting to say, he might be on to something. I've seen this with my patient. This one really stumped me. I did notice when he just talked about doing some of the acupuncture stuff, that kind of makes sense. Where would they go if they want to just take one step? Just one. They don't have to commit to being a biological dentist. They don't have to. They just want to say, okay, let me research a little more about this and see if I can apply some of this.
Well, the organizations I just mentioned, the
Good for them.
International Academy of Biological Dentistry Medicine. Dawn Ewing is our executive director. We have a team of people that have been there forever trying to promote the academy. And the IOMT also has good training. The major difference between the two organizations is the IBDM, we don't believe in root canals at all. It doesn't matter how good a root canal is, it's just a matter of time. How many people want to keep a dead organ in their body?
So this is something that I have personally when I talk to, and it's on some of my other videos, so I'll back it up, in that I tell people, if you go in to see a dentist and he says, well, we got to do a root canal, my personal, no one else is suggesting this, and you can't take away my dental license, so whatever. But my personal opinion on this is skip the root canal altogether, and in my opinion, if you need a tooth there, go with an implant. Now, with what you're saying, you prefer the zirconia implants to the titanium, but if you're going to go with an implant, make sure the doctor gets out all the periodontal ligament. That's a big piece of this. Can you talk on that? I mean, I know I'm jumping around. I'm sorry, guys. I am, it can happen, but this is crazy. This is an interesting conversation. If I'm going to go, and I've been in the surgeries, I wish I hadn't, but I've been in the surgeries. I've seen the extractions. How do you clean the periodontal ligament out?
Well, your technique to remove a tooth should be as atraumatic as possible. There are different instruments that you can use to loosen up the tooth within the socket. If you have a big molar that's got roots that go into 3 different directions, you'll see that the hole here, where the tooth comes out of the gum, is smaller than the mass of the roots.
Yes.
So first you split the tooth and you divide the roots. And then you take one root at a time. I use a piezo surge, which is a vibrating instrument, and it has special blades, and I go around each one of those and I loosen it. And then I try to remove it separately, which is less traumatic than just going, I'm going to pull it out. And then you do each one of those. Then you can take the piezo art or a surgical round burr and remove about a millimeter and a half of bone. But when you get down to the bottom, you can use hand pieces too. Sometimes I have friends that just use a hand piece. They're nervous using a surgical burr to take things out.
Sure.
It's, what can I say? I've done over 25,000 of these things. So I'm used to different things. But I just learned new methods last year. So you always want to learn.
I love that.
And I
love that.
when I go to a conference, if I learn 2 things at a conference, it's been worth it.
Yeah.
And one guy said to me, why don't you come to my class? I said, well, what do you want me to teach? I know the person.
Yeah.
But there are other guys that are just great.
Yeah.
I've gone all over the country learning from other people.
Yeah.
And I go to traditional guys. I might not do what they do, but they have the technique.
Yeah.
So why even get an implant? Why do that? Because when I sit there and I tell a person, we have a removable partial. It's a piece that's like a denture that sits on the teeth and will make up the space. Okay. Well, it rubs against the teeth. Liquid gets caught in there that might have some sugar. It rubs against the enamel, and the enamel becomes worn away. Your kids can play with them. Cats and dogs chew them up all the time.
Quickly.
Yeah.
Dogs love them.
Love them because they're a chew toy.
Yeah.
But the advantage of having an implant is you're stimulating the bone. You have to have enough bone to put an implant into.
Okay.
But it is going to put pressure. If you put pressure on a bone, the bone pushes back. And as long as that pressure is balanced and you have the proper bite or proper occlusion, that bone's going to stay there. If you see that woman who comes in and has no teeth like this, all the bone went away. Why? Because it didn't get stimulated.
Wow. So that is what will help against the resorption is the actual bone stimulation?
Yes. Our bodies, you need to exercise, you need to move, you need to get up and get off the sofa. Heck, if you can, get something that, a small walker or something, or a bouncer or something, get your buns off the chair and exercise. Walk 20 minutes a day. And I'm not talking about like running across the clinics and doing stuff. Get some peace and quiet. Now, my wife's going to hear this. She's going to laugh so hard. She's going to say, yeah, because when I get done with work, I usually get here about 6. I'm happy to leave by 6. And then we'll have time with our family, our son, and put him to bed. And then I'm working another 2 hours getting notes and things prepared from today and tomorrow.
Yeah.
So it's,
So you're not walking 20 minutes like you're suggesting?
I don't usually have time for it, but I used to be in a lot better shape because of accidents and stuff. Yeah. But the whole thing is I do get exercise. Yeah. I chase a 9-year-old. That's
exercise in and of itself.
Yeah, considering my eldest son is 41 and we adopted a grandchild, it's
keeps you young. And you know what? That's actually, it's funny. It does tie in because you've heard that, well, it's keeping me young. It really does, because it stimulates you, which is what you're talking about, the bone. In order for the bone to stay young, it has to be stimulated.
That's right. And keep it healthy. So that's why we look at the bone from a different point of view than many others.
Yeah.
Now, the use of lasers today in periodontal treatment is phenomenal. Yeah. It works so well. But the book that Dr. Levy, I mentioned before, Hidden Epidemics, talks about the dangers of root canals, talks about the dangers of past extraction sites that weren't cleaned out appropriately because you have a production line. Many oral surgeons have been in offices. They get one room done, they get a person sedated, they get them numb, they get another room sedated, another room sedated, another room sedated. They go back, pull out the teeth in the first room, get the next 2 numb, pull out teeth here, and get them going. We clean out the socket. I suture 99% of everything. I put PRF within the sockets, unless they're a Jehovah's Witness. Can't do that. But Jehovah's Witnesses don't use blood products of their own for healing. They won't take a blood transfusion. So
really?
So you need to know your market. So I always talk to the patient, what are your expectations? What are you looking for from me? Because I want to be realistic.
Right.
I had a woman who came in, she was 60, 75 pounds heavier than she should have been. She was a very nice lady. She pulled out her picture of her when she was 21, drop dead gorgeous. The best smile you've ever seen. And she says, these crappy dentures are terrible. Can you make me look like that? I said, I can make a set of dentures like teeth like that, but what about the rest of you? I'm blunt. I could have been maybe a little softer. But the fact of the matter is, I could never reach her expectations. So most biological dentists will do this. They'll ask, what are you looking for from me? Because one, I can't guarantee anything. I promise you I come sober. I do my absolute best. And I try to listen. Sometimes it's difficult because you're focused on trying to do things. And other times, you may not be able to help somebody.
Yeah.
And you want to tell them that up front. Because if I can't meet their expectations, I can tell them where their expectations might be too high. It may not work.
Yeah.
But it's patient management.
Yeah. One of, and I do want to cover this because I got derailed from saying this earlier, but just because you don't do the 4-on-4, 1 fixed arch, 4 implants, but I looked at some cases with you without seeing any patients' names. We didn't violate any HIPAA, but I got to see some x-rays that you showed me where you did some really amazing work with about I think it was 8 zirconia implants on top, and you did bridge work.
Right.
And you also talked about how you have a technique that you won't a lot of times do a full arch fixed, that you'll break it up into 2 bridges and you'll split that up. Talk to me about that.
The human skull is amazing. We were taught in dental school, once your skull developed and you were an adult, the bones went like this. They didn't move. Well, they're wrong. The suture points have a little give and take. The maxilla moves this way and that way, this way and that way. Ayurvedic medicine, which is from India, you can get the pulse of a person, which matches the pulse, not your blood pulse, but your cerebral spinal cord pulse, which is 12 to 15 times a minute compared to your blood pulse. I'm not very good at that method.
Sure.
But you take a bridge and go from here to here, where your jaw was going like this, slightly, it goes like this. It can't move. They're losing a part of their ability to function. If I had my way, I would love to do these 2 parts up front separately and then from the canine back separately, but you can't do that. So I try to keep it so this can move in the midline if I can avoid doing that. I try also to avoid putting implant right in the middle of the midline. Number one, it would look a little silly, but you can do that on a 4-on-4, or the Mish Institute has a great system where from canine over to canine, they'll put 4 to 5 implants in, and everything rests back, and they can go back to about the first molar, and that will support it nicely. And then the same thing on the lower. So those are really, really great things to be able to have in your back pocket. But if you're doing a true 4-on-4, you must do it with a very well qualified oral surgeon.
And I love that you brought that up. I brought it up in my other videos. You can be fresh out of DD. You can get your DDS one day, next day. Technically, you can go do this procedure. Sadly, but it's true. Should they? No. Can they? Yes. And I think that is something that I'm really glad you brought up, that going with a specialist that is going to treat, that has done hundreds, if not thousands, of these kind of cases, that this is not their first rodeo, is highly important. And yet you talked about something, Dr. Margolis, that really, when I first talked to you, I thought, well, he doesn't do any full mouth restorations. But after looking at that, you sure do. You can do full mouth restorations all day long. It's just a different modality than what I had done. Mm-hmm. And that what I've talked to some of the others, but it really is compelling. I'm sensing it might be a little more expensive, but I also am sensing it offers a little more freedom and flexibility.
Well, everything is individually categorized for that person, number one. Not everybody can take the same materials.
Yeah.
So we just had a great loss in our community. A gentleman by the name of Mr. Clifford died of a heart attack, and the lab had the best bank of testing products. And now I'm in search of another one, and there's one that I know that I'll probably go to. But we can't get the materials tested. It was a blood antigen test. So you can generally narrow it down and go with and decide what to avoid. Yeah. That's the most important thing. So there are other methods that are woo-woo, but I'm not going to go into that.
Yeah.
You can do it if you have the bone. Bone is the issue. Bone is a principle of the foundation, and tissue is the other issue. Yeah. Of how are you going to make it look good. Because people don't want to put these things in and smile, and all of a sudden you see these black roots. Yeah. And that's another nice thing with ceramic. Ceramic is white. It's not offensive if a little whiteness shows through compared to a black titanium surface.
Yeah. I have one. I mean, I'll even show the picture. I had an implant go south, and it was that. It was, you saw the threading. It went on the buccal side. It was exposed, and
The other thing was zirconium. The products that I've used is that the tissue's actually attached to it.
okay, I thought, and this is one of the big arguments for titanium, was it's the only metal that is compatible or with our bone, or that's what will integrate with our bone. Is that what the argument is?
I don't know if it's the only metal that integrates with the bone. Not that smart. But it does integrate. I have it in my knee. But the difference with my knee and my mouth is I don't have the oral environment around my knee. I got a closed environment around my knee. So I see this. I did want to get a zirconium knee, but I didn't want to go to Europe and get it. Because if anything went wrong, where do I go?
Right.
So, I did have it coated with a ceramic when the surgeon put it in. He guaranteed me that that's what he did. And he even saved the little sticker thing that said what it was. And so, it's a question of how you do with metals. I think I'm pretty much non-reactive. But I'm going to go with the zirconium because, one, it's biocompatible for me and most of my patients. 6% of the American population cannot take a zirconium oxide implant because they got exposed to aluminum oxide. Aluminum oxide and titanium and zirconium are all in the elemental chart together. Take a look. And you will see, what did women use for a deodorant, antiperspirant? And what was it in there that caused breast cancer? Aluminum oxide. They're taking and putting aluminum oxide here, and it drains down into the breast and then out. And that is one of the theories that women got breast cancer by antiperspirants.
Because the aluminum, and when you look at, and that's when you look at,
aluminum causes,
it's huge on all the antiperspirants.
yeah,
It's still the number one ingredient.
yeah, and you don't want that in your body. There's others that are,
Or just deodorant,
yeah,
where it
deodorant
doesn't have the aluminum. What? Couple things, and I'll let you get home to your family.
Really?
Yeah.
We just got started.
Well, don't say that. I can run long. When you're going down this path as a patient, what are some things that you specifically have helped a lot of patients with? You touched on some of it, but how, if I'm a patient out there, how do I know that I need to probably, I know everybody should probably look at a biological dentist, but what are the ones that are more prone to, if you're having some of these symptoms or if you're having some of these challenges or that kind of stuff, to go look for a biological dentist?
Well, first you look at the three organizations I've already mentioned. Not every biological dentist is the same, period. As one person said to me, I won't do the things that you do because I can't do it. And we didn't even get into ozone.
Ozone's great.
Ozone is a wonderful thing. I use it in my extraction sites. If I see a patient starting to develop a little radiolucency underneath a tooth, which is probably an abscess or beginning of an abscess, I start shooting that up with ozone. I do numb the patient up first because the first time I did ozone on myself, because I want to make sure it was safe, I took a big syringe, big syringe, and I just went like this and went voomp. I woke up about 10 minutes later in severe pain, and then I realized that all I needed was 3 cc's, a little tiny bit. But I literally passed out in the room next door.
Oh my God.
And I just sat there and said, I will numb people up first.
Yeah.
And anyway, gosh, the question of what we help people with is everything from any kind of arthritis, fibromyalgia, chronic fatigue, digestive problems. And please understand, I do this with other doctors.
You're part of a team, and you play your role while they play their role.
We're all a cog in the wheel.
Okay.
So when anybody tells me, this is what I did for this patient, no, I've never healed anybody. I want that straight. I want that understood. You will heal yourself. We just give you the ability. We get rid of the obstacles. So the old story is God was talking with a cardiologist. And at the end of the conversation, the man went up to God. He says, what did you learn? And God said, I know I'm not a cardiologist. So the whole thing is, we aren't gods, we aren't anything. I have patients that come into me and give me a big hug and kiss, thank me because they had a child, because I got rid of the obstacles here.
Yeah.
I had one lady come in, she was trying to breastfeed her child. Tooth number 14, the first molar on top, was a root canal. I did the acupuncture injection. And we went from here to my consultation room. And by the time we got to the consultation room, the whole left breast that did not produce any milk had dumped milk, and she was dripping wet.
Oh my gosh.
And she looked at me and she said, I'm so embarrassed. I said, don't be embarrassed. We have a washing machine here. I got her a shirt and stuff and a lab jacket, and we washed her bra and washed her shirt. They had it dry. At the end of the session, at the end of our consultation, she could go back and put her shirt back on. And I told her, I said, this is what you need to do. You got to pull the tooth. I can't pull my tooth. I said, I just showed you what was stopping you from producing milk. That can't be good for you. And she says, oh, I was taught by my father, who was a dentist, you never pull a tooth. Never saw that lady again.
Oh, man.
So, you know, I can go on stories that people actually do get scared because we tell them what we see. Imagine taking a look at an x-ray and asking somebody, well, do you ever have a problem that your heart gets erratic, a rhythmic heart? And she looks at me and says, I have deep anxiety. And that brings us into another subject that we're not going to get into today, which is sleep apnea. Because that machine that just took Daniel's pano, I can show him his airway. And I can show if that's clear, not clear, and why he snores, and why he's exhausted or tired during the day, and also how to lose weight. How to lose, and you're not heavy. I'm not saying that. But
you could tell that I snore?
I could show you some things that I've already looked at. But I
He
didn't go
snores,
into-
I promise you.
He does?
Very.
I could show
I
you in
don't,
a program.
America.
But the whole thing is that dentistry is a part of people's health. I can't tell you how many times I've talked to naturopaths who don't refer to me, and I say, why is it that you didn't look in their mouth? I sometimes teach over at the Southwest College of Naturopathic Medicine. I teach the graduate students who are running through a program. A young lady by the name of Betsy could open her mouth about this wide. She had TMJ problems. And I looked at her and I said, would you like me to get rid of that today? She says, nobody can get rid of it. So I did acupuncture at the TMJ inside the mouth on both sides. And she went from 5 millimeters to 55 millimeters in the time I put down the syringe. She started crying and she got up. She says, Doc, I don't mean to be rude. I'm going to go eat a hamburger. I have not had a hamburger since my wisdom teeth were pulled when I was 16 years old and she was 23.
Oh my gosh.
So the stories are there.
Yeah.
The question is, how do you write this up and publish an article?
Yeah.
Because people will sit there and they scratch their heads. Yeah, right, okay, sure. See you later.
Yeah.
Because our results, you don't do double blind. Each person is
It's
separate.
individual.
And you can't do the exact same thing for the next person.
That's so
That's
good.
biological dentistry. You have to try to get into not only the mouth, which is part of the head of the patient. And the most important thing, know their expectations, listen and write them down, and say, what are you expecting from me? How may I help you?
Well, I can tell you you've helped me, and I believe in that you've helped with the education side. I mean, it almost goes into a whole, like I said, a whole nother list of questions. But what I'm gonna do is I'm gonna put some of these links in. Sure there's gonna be a lot of questions, and if it's all right with you, if I have some of our viewers that have some questions, if I can forward them on to you.
You can not only forward them on, but we have a telephone number. It's 480-833-2232. They can call the desk, ask their questions, write them down. I don't go to my emails, okay, because I get so many emails a day that I have to erase 60 or 70 emails, and I would hate to erase somebody's email.
Yeah.
But if people become patients of mine, they have my cell phone number.
Yeah.
And they can text me.
Yeah.
Texts are much better.
Yeah.
But the thing is that I try to be available. Drives my wife nuts.
Yeah.
But she's a good person. And she's seen what we have been able to do for other people. So when I first met her, I asked her who her dentist was. And she looked at me, she says, well, I go to this doctor. I said, how many root canals do you have? She looked at me, said, what do you mean? Let me tell you, what happened was you had a little cavity, right? And he says, we got to fill that right away. And then he prepared the tooth. And then he put a white filling in there, right? And then 3 months later, you started hurting so bad, you called him as an emergency patient. They got you in right away, and he started a root canal, right? And then after the root canal was done, he sold you a crown. Is that correct? And she said, how did you know? I said, when you put a white filling material in, you put a liquid on top of it. Now, we used to use an acid and then a filler. They now have where there's an acid and a filler, and when you put a light on it, it stops the acid from working, it converts the material, and now it can grab into the enamel and hold a physical hold. And then they take filler material that chemically bonds to it, and now you got your filling. So what he did, he drilled it so it got real close to your nerve, but didn't expose it. He put that stuff on there, and then he put the other stuff on there and then hit it with a light. The stuff was never deactivated. And within a few months, no more than 4, you're begging for a root canal. So she looked at me and says, why don't you turn them into the board? How could you let something like that happen? That, I guess, is acceptable dentistry. So
you and I have a same passion for it. And it's not, again, for the record, I don't have a hatred of dentists. I have a hatred of poor dentistry.
Okay.
And that is really the...
And the crux of poor dentistry, I have seen some phenomenal dentistry done. But because of the materials they used, and because of the chemistry of the patient, it fails. And that's the sad part about it. Because when we were in dental school, we were taught, never put a gold crown in a mouth that has mercury fillings. Hell, I see mercury packed around a gold crown, let alone in the same mouth. They forgot about that once we got out of lecture and went into clinic. Because we didn't have any other materials at that point to do a buildup so you could put a crown on it. So what do?
Yeah. Well, I appreciate you stepping out and doing what you have done. I know you've taken some bullets for this.
Oh,
I know,
many.
I know, and I know that that a lot of times it's probably a thankless job. But I appreciate you doing this, not only our time together, but what you've pursued for patients and the overall health, and the extra time, energy, and effort you took to go get other degrees, other education, to really look at it from a full perspective. I just want to commend you for that. So thank you for doing that.
I appreciate you coming. Thank you for that phone call by some strange guy.
Yeah.
And next time you see Dr. P, when you see, are you going to see him this week?
I'm seeing him tomorrow, actually.
Okay.
Yeah.
I'll try to give him a call and just say thanks, because this has been a pleasure. And next time you're in town, give me a little more leeway. When you said...
You mean 48 hours is not enough?
Not enough. But you know what's interesting?
Sorry.
I sat there and I told you, I didn't prepare anything. And you sat there and you said, why bother?
That's it.
You know, why bother? I go through these things so often. I mean, my one son was into Taekwondo, and he pulled a muscle. And he couldn't lift his leg over his head. In fact, if he got it over 4 inches off the ground, it really hurt. And so what I did was I did acupuncture in his mouth, and he competed, came in third.
Oh my gosh.
And he just couldn't believe it. He sat there, how does that work? I said, don't ask how, just enjoy. And, you know, it's injuries can be helped. There's so many things.
Yeah.
So,
well, next time I come back, because I will be back, I'll give you a little more notice. And you know, I think this episode is going to probably create more questions than most of our episodes. So I'm excited about that. I embrace that.
yeah. And what I want you to do is talk to me. If you're going to send me some information or something, give me a holler.
I will.
Text me.
I will.
Just tell me.
I will.
And don't leave a voicemail. I don't answer it.
Okay.
And what we'll do is we'll take a look, and if I can help some people, fine.
Great.
I have many colleagues across the United States that I have a lot of faith in and can do well. I'm not the only one.
Right. I
Okay.
appreciate you saying that.
Yeah, well, that's important, because I wish every other dentist was a biological dentist. And people say, well, but your niche. You got a niche in this community. I said, I want a lot of niches, because then you don't get shot with arrows.
Yeah. Yeah.
So the more that we can learn, the more we can help.
Because there's power in numbers, and there's strength in numbers, and I love. So, you know, God willing, He will bless this, and there will be some dentists out there that go, maybe, and that's a start, you know. And hopefully, there's some patients out there. I know there are. I know it. That there are patients out there going, whoa, I never thought about this. Could that be? And I think it's a great place to start.
Yeah, and the crazy thing about it, everybody will call and ask, can I see Dr. Margolis? I have Dr. Kovar in here.
Yeah, that's true.
And Dr. Kovar was my son's instructor at dental school. He moved down here. He didn't tell me he was moving. I had an associate that just didn't get it. And I was looking for a new associate. And then my son said, well, did Dr. Kovar call you? I said, Steve never called me. Why? And so he got us together. He came down to the office, and he was working at some chain place, was very unhappy. And I said, how would you like to come work for me? This is what I offered. And he liked the offer. And he says, well, I can start. I said, well, I got to give the guy 30 days notice. And in fact, I actually helped the guy out and got him a job somewhere else. But he didn't fit in. He didn't understand.
Yeah.
He couldn't get the concept that root canals were bad.
Yeah.
Couldn't get the concept that, well, it's just an amalgam filling. Yeah, just.
Yeah.
I mean, I've seen people get root canals and become totally disabled within 6 months. So, what can you say?
Well, it's a step. You know
Yeah.
what? We took a step tonight. Dr. Margolis, seriously, thank you for your time, the heart, the willingness to stay after hours for patients you never even met, for a guy you heard 48 hours ago calling you crazy on the phone. Thank you for, I know you're well respected in the community, in the biological community, and for you to take time for us when you're as busy as you are. Again, from the bottom of my heart, thank you.
And thank you. I appreciate it. And Dan, take
Pleasure.
care.
Thank
Okay.
you.